Welcome to the International Association for Adolescent Health Pioneers Project. In this series, we have interviewed a range of experts from around the world who have led the way in promoting adolescent health in their countries, regions, or internationally. We wanted to listen to their stories and share their experiences so that these might be applied elsewhere. The members of the IAAH Education Committee were particularly interested in how these pioneers influence the education and training of healthcare professionals in adolescent health. In the following interview, Dr. Dick Churchill is talking with Dr. John Coleman, a pioneer in adolescent health in the United Kingdom.
So, hello, my name's Dick Churchill and I'm speaking today on behalf of the Education Committee of the International Association for Adolescent Health, IAAH. And I'm excited to be talking to Dr. John Coleman here in the UK. And the purpose of these interviews is really twofold. One is to talk to some pioneers around the world who've had influence on adolescent health and adolescence to really inspire other people around the world. And secondly, to get some practical ideas about how to go about it. So just by way of brief introduction to John, John Coleman has been interested in adolescence for quite a number of years now.
Many years.
And has had various aspects to his career, including running a research centre, a therapeutic community for young people, been involved in the civil service and influencing government,
Yes.
and also just in various academic roles as well over the years.
Mm-hmm.
And so I'm going to be really interested in hearing about all of those as we go through. And of course, in case I forget to mention it later, you were awarded an OBE
Thank you.
by the Queen Elizabeth II back in 2001, which is a great honour here in the UK. But we will talk through your career. As we talk, I'm going to ask you a number of questions, but feel free to wander and go off at tangents if you like.
Okay.
As I say, we'll cover some specific things, but really just want to hear your ideas, your thoughts about the whole field of adolescence.
Okay.
So, to get started, I wonder if you can give us a little bit of background as to why you got interested in adolescence. Was it anything to do with your own youth, or was it other things that influenced you to become interested in adolescence?
Yes, I'm always being asked that. Did I have a troubled years from 11 onwards? I don't think I did. I had quite a childhood and adolescence that was quite. There were lots of things happened. We moved around. We went to South Africa. I came back to England to go to secondary school, and I went to a boarding school. And at the end of my secondary education, I really didn't know what I was going to do. My friends were going to Oxford and Cambridge, and they seemed to know, and I had no idea. I really didn't know what I wanted to do. And by some very fortunate chance, a cousin of mine had been working in a refugee camp in Austria, and this was following the Hungarian Revolution.
Right.
And my cousin Anna said, because I was sort of a Toulouse, said it was like a gap year, although we didn't talk about it then. And off I went to Austria, and we could spend the next hour talking about that experience. But the refugees that were in the camp were really only a few years younger than me, and they were, in a way, the last ones to be repatriated or patriated into a new country. And it was very challenging, but it's absolutely a fantastic experience, a turning point for me. And that is what helped me to decide that I wanted to do psychology. Now, I didn't know at that time whether it was children or adolescents or whatever, but psychology was what I was interested in. And then I went to a university in Canada called McGill, Montreal.
Right.
And this was another sort of extraordinary chance because I had absolutely no idea what McGill psychology was like, or anything like that. And when I was going across on the boat, someone said to me, it's quite a funny story really, someone said, well, I suppose you're going to be studying Freud and all that. And I have to admit, I didn't even know who Freud was.
How old were you at this time?
19.
Right, yeah.
So anyway, to obviously make it, but one of the great things about being at university in Canada was, because students worked their way through college, we had very long vacations, summer vacations. And so both the first summer and the second summer, I had really fascinating jobs, and both of them were with teenagers. So I think that was a really important sort of turning point. And psychology, as you probably know, is fairly experimental, even in those days. And I was just pushing and pushing for, I want to do my project on children or young people. That's what I want to do. I want to write my thesis on that, my undergraduate thesis, and so on. And so that really is how it all started. And then I came back to England and I started a PhD at University College London. But I was really, I knew I wanted to do that and get the PhD out of the way, but I was really interested in the work. Mm. And I was incredibly lucky because at that time, training in clinical psychology was pretty ad hoc, really. And as long as you could find a principal psychologist who would sort of look after you. And so, amazingly, my last year of my PhD, I got a post at the Middlesex Hospital, sadly no longer, in child psychiatry. And so I finished off my PhD and completed my training as a clinical psychologist. And that was the beginning. And then, and I know this is very much focused on health, so the next stage was also important and relevant, which was that the London Hospital, as it was then, it's now called the Royal London, had just established a new department of psychiatry. Mm-hmm. And quite unusually, the man who was appointed as the head of department was actually a child psychiatrist. And he was very, very keen that we developed a whole range of programs to do with children and young people. And they were advertising for a lecture in clinical psychology. And someone said to a colleague of mine at Middlesex, said, you look at that, you should apply for that. I said, ridiculous, I'm 27, they're never going to take me. But anyway, I got the job. And so I was there from 1967 to 82, so 15 years. Mm. And during that time, all sorts of things developed. The man who was the head of department, someone called Desmond Pond, was so innovative, and, community psychiatry was what he really wanted us to do, and focusing on children and young people. Mm. And it was a really dynamic department, lots of people who, were at the forefront of their fields. Mm. And Desmond Pond also was really good in that he invited all sorts, and Aidan actually was one of the people who was invited to come and talk. So he brought lots of people in. And so essentially, that's my first, I suppose, 20 years or so of my career.
Great, that's fascinating.
So, we've talked about the first 20 years of your career, but there's more to come.
There's more to come. So, would you like me to go on?
It's great just hearing your story.
By the time, around 1980, I began to get quite frustrated. I applied for a number of chairs and didn't get them. And I think that I was beginning to feel that medical education probably, was quite a narrow path to be pursuing. And I was beginning to feel that I wasn't really in the thick of it. I was doing some stuff in Whitechapel with a youth group, and I was able to do some research on adolescent development. So I was definitely able to work in that field, but I suppose I just felt frustrated. And so a bit of an extraordinary thing, But I resigned, and with lots of people's help and funding from various places, I set up a therapeutic community for very troubled young people. And basically the idea was that the young people would have as much ownership of the community as the staff. And a lot of it was based on the young people getting together and working out the rules, how they should behave, how people should be sanctioned if they misbehaved, and so on. It was very much about giving young people a voice. So our therapeutic community that we set up was based around a community meeting once a day.
Right.
Now, it was education and care, so it's 365 days a year. So we had teaching staff and care staff. And basically we did the community meeting at lunchtime. So this was, the idea was that they'd have they go to school in the morning, then they'd have quite a big break. We make sure they have exercise, community meeting after lunch, and then they go back into the classroom at the end of the day. That was the principle. I think it can work, and I had actually seen it working in the US, because before I set up the school or the community, I had done a wonderful trip in the US visiting 6 different facilities for very troubled young people, all sorts of different ones, all sorts of, some crazy, some very straight down the line. And I wrote it up. I can send you, I've got an article which I wrote about it. It's called Residential Care and Young People. But I think we had such troubled young people. And I think the truth is that that sort of work can be successful, but either you have to have a pretty tight structure, or you have to think very carefully about who you're going to have in the community. And it happened really at a time when Thatcher's cuts to local authorities were taking effect. And the consequence of that was really that local authorities were only really willing to refer young people who they simply had no other option for. Right. So these were kids who'd been in and out of foster care, probably been to other children's homes. And the level of difficulty and trauma that they'd experienced was really, and it was a time when sexual abuse was becoming very much into focus, and the referrals had changed really dramatically over those first years. And at the beginning, we would have 1 or 2 who were there because they'd been sexually abused by a stepfather or something. But by the, in 5 years' time, you weren't getting any referrals where that wasn't part of the problem.
Right.
And we had a lot of sexual acting out and all that sort of thing. So, the school lasted for 20 years, so I'm quite proud of that.
Yeah.
I didn't last 20 years. But I became, it was a charity, and I became the chair of the trustees, and then started doing other things. But we're still in touch with some of the residents who are now in their 50s.
Yeah.
In fact, only last week I got an email from one of the young people who is now, I think, 50, who is in the Czech Republic and doing really well. Wow. So, and I'm very much in touch with some of the staff. And in fact, I'm meeting up with a couple of the people who became the directors after I left next week. So we're very much involved still. So then I, obviously it was a bit of a sort of challenge to where was I going to go next? Was I going to go back to an academic career? It didn't really appeal, and anyway, I wasn't sure whether, because I hadn't been writing research papers or anything, obviously. So at that time, I was I've had so much luck in my career, it's extraordinary how much luck has happened to me. But I had been asked, I can't really remember quite why, to go on the board of the Prince's Trust.
Right.
And at that time, well, it's called the Jubilee Trust because they were set up by previous monarchs in honour of jubilees.
And it might just be worth saying for an international audience what the Prince's Trust is or the trust was.
So what happened with Prince Charles before he was king was that he combined all these, and he had a passion for young people, still has. And so what he wanted to do was to use the money, the trust's money, to support young people where, you know, they'd faced difficulties, they wanted to try a new business idea, or they needed help after foster care. So in fact, they were giving out money all over the country, and mostly it was to individuals, not to organisations. But they did have applications from organisations and from universities, and they wanted someone who would help them sort of sift the applications. And so they asked me to go on the research, I think it was called the Grants Board. And then gradually people left, and I became the chair of the Grants Board, which is really interesting. And of course we worked with Prince Charles, HRH as he was known, and I told them that I stood down from running the therapeutic community, and we talked around these things, and they were very keen. I said, you know, there's a huge gap because there's no real focus on any research on young people. There just isn't in this country.
Sure.
And if you look at the universities, there's lots of stuff around child development, but really very, very little. And Prince Charles and the director, Tom Shabir, got very enthusiastic. And so it was just a fantastic piece of luck. And they said, well, they'd like to fund me to set something up.
Wow.
So, I mean, I could never have done it without that.
No.
And so they funded me and 2 research officers to start the thing off. And that's what we did. And then the big question was, well, what topics we were going to focus on. And so health was a big theme for us. It was always a big theme. We were very, very interested in the mental health issues. At that time, very little, focus on that. We were interested in puberty. And again, we sort of worked with some paediatricians to develop some work around getting a better understanding of puberty. We were very interested in exercise, and we had a nice project in Brighton schools, really looking at how much exercise and how, particularly we were interested in girls and boys, and how girls, by the time they get to 12 or 13, they're obviously going through puberty, they're sort of, they don't want to do exercise, and we were really focused on that. But we also were very lucky and got all sorts of funding from all sorts of different sources. The prison service was very interested, and we did some very interesting work actually training prison officers in understanding adolescence, which was incredible. We got a big grant from British Telecom to do a study of communications. And what we looked at was how young people managed communications with doctors, police officers, and welfare officers. And we actually compared the 3 and wrote it up, and we had a huge conference and everything. Yeah. So anyway, there was a big sort of range of things. I know I'm talking probably too much, but
no, it's great.
So basically, it grew. The trust grew, and we were incredibly fortunate that along came a change of government and New Labour, and a number of cabinet members had either been teachers or youth workers, and so the whole thing changed. When the Tory government was there, we were fighting against teenage pregnancy and all that. But of course, when New Labour came in, and that's when I started to work much more closely with government. And we got lots and lots of money, and we got all sorts of extraordinary grants. There was a grant program which the Treasury ran called Invest to Save, and so we got money for that. And a lot of work on families, on parenting, and so on. And we grew. I think when I retired, which was 2005. I think we had about 35 staff. So, it went from a tiny, tiny acorn, and I feel really proud of it. It was, and people still talk about it. They still talk about it. And I'm actually doing some work in Wales now with people who we worked with, in like around the year 2000, and I've kept those contacts. So, okay. So,
but let's just
stop
set the position, because obviously, the story you told, a lot of that early stuff I wasn't aware of, but we've now got to the point where there's an increasing interest in adolescence.
Yes.
Through your work, you've actually established more of a research base for it. And you've got real interest from government, but also from royalty.
Yes.
So if we're starting to pick up on lessons for other people in other countries, other regions, saying how could they stimulate interest in adolescence. It sounds to me like you go to your monarch, you go to your government, and you influence things that way.
Yes.
Certainly that's the way a lot of your work's come about.
Absolutely. I think that's right. I think that it's definitely, because it's such, you said we want to talk about adolescence generally. It is still so hard to get policymakers interested in this age group. And now today in the UK, with austerity and the cost of living, who is really suffering? It's this age group. It is really shocking. And I think it is correct to say that there is much more interest in young people's health. I agree with that. But if you look at the services, if you talk to teachers, health professionals, they will still say that young people are getting a terribly, terribly poor deal. Youth services in this country have been cut again. I know this isn't entirely true in other countries. Some European countries are much, much better than us. But I think adults still have a very complex attitude to young people, even though I would argue that we really do understand adolescence now, particularly because of our knowledge of the brain. I still think that there is this sense that young people are contradictory, challenging, puzzling, difficult to relate to because communication is tricky. I think there's always been that sense that this age group is quite a difficult age group to engage with, and I think that feeds through into we don't do any. In Oxford, when I was in Oxford, they set up a master's in child development. What was called initially child and adolescent development. When I looked at the curriculum, it stopped when they went to primary school. What? Honestly, this is true.
Yeah.
And if you look around the country, in this country, I know it maybe not quite the same in others. I think Australia is much better at focusing on young people. But if you look in this country at master's programs, you'd be really hard put to find anything on adolescence. It still isn't that.
It's still the same.
Because there aren't the academics who want to be teaching that. So I think it is some
way to go.
There's some way to go, yes. So I think if we're looking at sort of lessons, I do think my experience has been finding a way to get as high up as you can, because you want to have people who are influential, who can really help you either through funding or allowing opportunities to develop. I think it's a long way to go, I really do.
But just changing tack a moment, when you were at the Trust Study of Adolescence, I think one of the key outputs I remember, and I know there were lots of outputs, but was you started to collate data on adolescence.
We did.
And this has been quite an influential piece of work that has continued in various ways over the years.
Yes.
Do you just want to comment about the importance of data?
I had this idea because what was happening at the Trust was that we were getting these calls from journalists saying, can you tell us, is teenage pregnancy really going up? Or what's the latest suicide data? And I said to the team, look, I think that there is something in this. And I came up with this, what I thought was a brilliant idea, which was called DIET. And DIET was digest of information on adolescence today.
Brilliant.
Well, it wasn't. They didn't like it at all. So it got rejected. But we did start doing it. And I mean, it was honestly, like back of the envelope stuff. And we were very lucky. We managed to persuade a retired librarian from London to come and help us put the first one together. And it was very short, really. We had the key things. We wanted to do something basically about family and education, but we really did focus on health. So apart from family and education, we had 3 chapters on health, so sexual health, physical health and mental health. And then I was very, very keen that we did something on offending behaviour. So we had a chapter on that. But yes, that was 1997.
Wow. Yeah.
And so I'm so amazed that actually in 2020, was it 2022, we actually were still, AYPH was still publishing it. And they will go on publishing it, but probably in a slightly different form online, which is right, is right. But you're right. I mean, that was also quite a breakthrough because no one was really providing that sort of information. ONS, it wasn't called that. Anyway, the Office for National Statistics did make one attempt, I think because of what we did, they did one in 1999, and they had 20 staff working on it, and we had one person working on it, and we did it much faster than they did. I'm very proud of that. But that's the government has never ever put any more money into anything like that. And you probably remember when we had such struggles really trying to find funding, and the fact that I was working in the Department of Health was a huge help with that because the civil servants really, sort of introduced us to people who were initially not very keen, but we did manage to persuade them to go on funding. And so and then the Health Foundation took over and so on. So again, we've been very, very lucky. But that was something that came out of the Trust, you're absolutely right. And there were lots of things that we did develop, but that's probably one of the big achievements, I'd say. Yeah.
Absolutely.
Yeah.
Amongst many, as you said. I wonder if you can change track just for a moment, and I'd like I mean, obviously you haven't worked in the health service per se, so you're sort of viewing things from an outside perspective. I'm interested in your view on health provision for adolescents over the period of time that you've been observing it, and also how health professionals get trained and how they approach young people. As an observer, what are your reflections on that?
One of the things that we did at the Association, we got, or the British Medical Journal got in touch with us and asked if we'd run some training for GPs. And this was really interesting. Incidentally, much earlier in my career, I'd had a sort of honorary link with the University of Sussex. and their Department of Continuing Education was responsible for all the GP training in Sussex.
Yeah.
And so much earlier on, I think partly because of my time at the London hospital, I was running or doing quite a bit of the GP training in Sussex.
Right.
So that was all very interesting. And what I found was that you had a group of, let's say, 12 GPs, and you'd have maybe a couple who really were interested and thought this was so important. And then the others were, well, I suppose we've got to do it, but, it's not really it's not our main focus. And it was fascinating with Anne Hagel. We ran these BMJ workshops, and there was remarkable ignorance about young people. And the ones, there were big groups, they had 100 or 150 there, but we did manage to take questions, and we also stayed around afterwards, so you had lots of GPs coming up to you and so on. And I thought that, in a way, it did reflect exactly what I've been saying, that you've got a few who maybe have got teenagers of their own, who see this as something really important. But an awful lot of them felt very, very concerned about not really managing a consultation properly. How did you get them to talk? Could you be sure that what they were asking about was really the thing? And even though, people like Chris Donovan have been made films and so on, I am really doubtful as to whether there has been very much change. I think that I certainly haven't seen it. I suppose the closest I've done recently is school nurses, who come on the courses that I've been running and saying, well, we haven't had anything. We haven't had anything like this, No one's talked. we're school nurses and no one's told us anything about, okay, yes, we get like 5 minutes on puberty, but it's mainly, vaccinations and all that stuff. And of course, we're frontline people because young people come to us and so on. No one's told us that. No one talks to us about adolescence, So my take, and you're right, that, obviously I haven't been, since I was at the London, I haven't been in the healthcare profession directly, but I am not sure. I don't know how to make a real system change, the honest truth, Dick. I suppose if I was putting my optimistic hat on, I would say that the our knowledge about the brain has the potential to really make a big change. And my argument is that if you think about schools, 30 years ago, if you said to a school, I hope you're doing something on puberty, they would say, puberty? That's parents' responsibility, okay?
Yes.
This is honestly true. Now, if a school isn't teaching year 5 and 6 about puberty, Ofsted is going to say, where's the stuff on health? So 30 years has seen a really big change. And my argument, my belief, is that 30 years' time, it will seem extraordinary that a school is not teaching about the brain. Because I think it's a human right. I think young people have the right to know about what's happening inside their brains, but also it completely changes the way adults relate to young people. And it takes away that sense of, puzzlement and why they're so contradictory and difficult and so on. And my experience running workshops, both, with school nurses, with teachers, is that it's a light bulb moment. They simply don't know this. And so I don't know how many other people you're going to interview are going to say this, but I really would say that I think that's going to be a big change. I think once people really cotton on to how much insight this gives us into this age group and how it leads to change in the way we deal with sleep, we deal with mourning, we deal with moods, we deal with not considering consequences, whatever it is. I think it'll be a big change. Now, I'm not sure I've answered your question, but I've probably gone off on a bit of a tangent.
No, that's fine, because you've emphasised one of the areas which I know you've had a particular interest in is around education of teachers, isn't it? And parents.
And doctors.
And doctors, yeah. And I wonder, though, how many... we talked also about GPs, but we've got the specialist areas of paediatrics as well. And again, I wonder how much they... I mean, we know people who are specialists who are interested, but again, I suspect it's very similar. There'll be those with a specific interest and those who aren't really.
I think that's absolutely right. Yes, I was talking to someone who's a paediatric nurse in Sussex the other day, who's a daughter of a friend of mine, and we were talking about exactly this. And she said, you know, it's so important for us to understand more about this age group. But actually, you know, it's so much of our work is early years. So much of our work is early years. She said, I'd like to be doing much. She's got teenagers herself. I'd like to be doing more. She said, we don't have the background, so it's just emphasising what you're saying. I think that's right.
So, John, we've got to the point in your career now where you've retired, believe it or not, from the Trust for the Study of Adolescence.
65, yes.
What's the next step for you?
Yes, well, again, I mean, I have to say luck, because I gave a paper at a conference, and afterwards these two very, very nice civil servants came up to me and said, we really like what you said, and what you're going to do now. And I said, a bit of consultancy, I've got a lot of writing I want to do. And they went away, didn't say anything. And then, to my amazement, Karen Turner sent me an email saying, would you like to come and have lunch? So I thought, yeah, okay, fine. And then it was just at the point where I can't remember quite what it was called. It was something about public health, Improvement in Public Health Act or something like that, had in fact been enacted in law the year before. And Karen said to me that John Reid, who'd just become Secretary of State, was very keen felt that the act was good, very good, but it was too light on young people's health. And what they would like, it was for me to come into the department and act as a policy advisor. I was complete, what? So anyway, that's what I did. And it was a very, very weird experience. And I mean, I don't think for this particular film, I want to spend too much time talking about it. But it is incredibly difficult to have any influence in government.
Frustrating.
It was very frustrating. But the good thing about it, and I suppose this is the link that we want to make, was that, of course, I was in the field, I was in the frame around adolescent health, and I did use that. And Aidan McFarlane, Anne McPherson, paediatrician, GP, yourself, GP, Russell Viner, paediatrician, we were getting together at that time and sort of pushing for more education, better focus, greater focus on young people's health. And it was, in the end, the fact that I had been there that enabled us to get that funding to start it off. Because, Karen Turner did encourage me and did ask me, we kept talking to Karen about needing something like this to, initiate, push things forward, break new ground. And in the end, she did. And, she said, put a grant, an application in. I put a grant application in for 100,000, and she phoned up and said, double it.
And of course, what we're talking about here for people watching this is the formation of the UK's Association for Young People's Health, which had never existed previously.
No.
There was never any overarching organisation that represented paediatricians, general practitioners, healthcare professionals, but also the wider voice of young people. And this was what we're talking about in terms of forming that organisation, of which you became the chair of trustees for that, of course.
Absolutely. I think I should acknowledge, and this is going back to what you were saying about, having links as high as you can, that I had worked with someone called Doreen Massey, who used to run the Family Planning Association, as it was called then, and then she moved to what was the precursor of the Sex Ed Forum, and then I didn't know that she'd always been a staunch Labour Party supporter, and she was sent to the House of Lords, and so Doreen has been an incredible support, and I don't know if you were part of. Doreen said when she heard about this, she said, right, well, what we're going to do is we're going to gather together, the presidents of royal colleges, the CEOs of the big charities that are involved, some people in the field, and I'll host a dinner in the House of Lords. You were there. And wasn't that an amazing evening? And she managed it so well, and she gave everyone 3 minutes. We went round the table to what are your priorities for young people's health? And I just think, that sort of support was so important, and it gave us the sort of put the wind in our sails and allowed us to, and of course linked us, and then we set up the APPG, the All-Party Parliamentary Group on Adolescent Health. But having that sort of support really does, of course, make a difference. So, as you say, get to your legislators, your senior people in government, and see if you can find someone, if you're lucky, who you've got a link with, who can really help you and support you. But that was very important for us. Yeah.
But what I'm hearing from you throughout our conversation today is very much how you've made links with people and kept those links going. You've networked very effectively at all sorts of levels. And that's really been one of the strengths of how you've helped to build up the profile of adolescence in the UK.
I think you're right. I mean, I probably don't see it much like that, but I think that I suppose because I think that there have been so few people like me, and so what's happened is that people who are interested in this age group have somehow made contact in one way and another. I mean, partly it's public performances, it's lectures. A lot of people, come to me, well now, of course, through the internet and through websites and things. But I'll give you a really good example. So I was in Oxford, it was 2012, and I got a phone call completely out of the blue, and this guy says, I'm the Director of Children's Services in Hertfordshire, and we want your help. I said, okay, didn't know him at all. He said, I came to a lecture of yours probably about 6 or 7 years ago, and he said, I was so impressed. He said, I'd never heard that sort of passion for adolescence. And he and his team, they had developed a program called My Baby's Brain. And they'd used neuroscience to develop all sorts of things, first of all for parents of very young children, but also for staff training. So they had health visitors and midwives and all that. And it was a huge success. And it's still running actually today in 2023. They're very proud of it. They thought they'd done a good job, which actually they had. And he said, we're so pleased with ourselves, and we want to find something else that we can do like this, and we've decided that we want to do something about teenagers, and would you help us? And I said, well, it sounds interesting, but frankly, I don't think really I know an awful lot about the brain. I'm not a neuroscientist. He said, you know about adolescence. He said, we'll bring in the brain stuff, but you know about this age group. And so that is how my whole team brain stuff has started.
Yeah.
So it was really through having given a lecture and someone remembering that who is it around who knows something about teenagers, and that's how it happens.
Yeah.
So it is networking, and it is the fact that there's so little really. There are so few. I just wish Anne Hagel and I. For this film, I should say that Anne Hagel is a colleague of mine who is also a psychologist who, going back to the key data, who's been the sort of lead person on key data since about 2010 or something like that. But she and I have always been saying how can we find other people? How can we encourage people that this age group is such a fascinating age group and such an important age group?
Absolutely. And that applies, obviously you're both psychologists, it applies through a health system as well, just getting that influx of people who can build up this reservoir to inform others, as you say. And of course, one of the things we haven't really talked about, just to mention, is the number of books you've written that have been really influential. I know one of my favourites is Why Won't My Teenager Talk to Me? And I know that's been translated. I noticed it's recently been translated into Chinese.
I know, Dick, I know. And it's a bestseller there. It's doing really well. Incredible.
Yeah.
It's so funny. The cover, they sent me a copy. The cover, I mean, it is honestly, it's like a Victorian cover. They haven't put real people in. So it's two owls on a branch squawking at each other. They can't actually put a mother and a teenager on the anyway. But yes, I mean, the books have been published and have been translated sort of reasonably. I mean, it's not like fiction, you don't have sort of 30 countries, but I guess most of them have got sort of 5 or 6 translations. So Italy, Spain, Japan, a couple of books have been translated to Japanese, South Korea, been interested, but Scandinavia and European countries mainly. I enjoy writing. And I probably, as long as I'm able, I will go on writing. I mean, the other book that's I suppose been, most people know about is a book called The Nature of Adolescence. And the 4th edition was published in 2011. And I am just discussing with the publishers to do the 5th edition.
Right. Yeah.
Possibly with Anne Hagel,
yeah.
Possibly as co-authored. And in fact, I've got a meeting on Thursday with the publishers, Routledge, to talk about how we're going to develop it, because it isn't going to be a 5th edition, it's going to be a new book, really.
Right.
Much has changed, much has changed. And in 10 years, the field, I mean, it's not just the brain. Obviously, we've had the pandemic, but also I think education has changed. The focus on mental health is different. The world is very different for young people. Social media, obviously. So, so I'm writing still.
Brilliant, that's good to hear. Now, we need to wind this up, because I could carry on talking to you for ages, but I think the cameras will run out in a minute.
Right.
I just wonder if you've got any key messages you would like to, or practical tips for people in any country that are really wanting to influence the adolescent health field, to get it started, if you like, and get it rolling.
Yes. Well, I think that the first thing to say is that I would encourage professionals to be more open to young people, not to be scared, because it might seem as if parents say to me, my teenager doesn't want to talk to me, they're pushing me away all the time. And I say, well, actually, they do want to talk to you, but they want to talk in a way that feels safe for them. And that may be late at night or whatever. Young people need adults. And I think that's often not understood, both by parents and professionals. So the first thing I would say is be more courageous and recognise that this is a very interesting, fascinating and hugely rewarding group when you can get past that sort of initial difficulty. I think the second thing I would say is really try and inform yourself more, particularly I think about the brain, because I do think this is a game changer, and I know I've said this before, but it has changed the way we understand this age group. And I can only tell you that in all my work with both practitioners, health practitioners, social workers, youth workers, and parents, this information does change them. And people say to me, I just feel more sympathetic. I really feel more sympathetic to young people knowing this. Secondly, I won't talk to them in the same way. I will really talk to them differently. And parents say that, and practitioners say that. And one social worker said to me, it's absolutely fascinating, having done your workshop, now, when I'm faced with a really angry young person, do you know what? I don't look at his mouth and his eyes. I look at his head. And she said it's so helpful because I'm seeing something quite different. I'm seeing what's going on in his brain, and that just changes everything. And I think I would say I'm a bit of a missionary, about this. I think knowing more about young people, the more you understand this age group, then the easier it's going to be to work with them. I think they have very special needs, this age group, or this age group has very special needs. And I think in a way, we as adults, whether we're parents, grandparents or professionals, I think in a way we've let them down. And I think that's partly because of the way they behave, because it's quite challenging. But I think it pays such rewards if you can get through that early difficulty, whether it's in a consultation, whether in primary care, or whether it's in an inpatient unit, whatever it is. I think that it is really rewarding, and young people can give you so much back if they can feel that you are listening, you are really listening to them, to their needs, not to impose your agenda. And one of the things I think we've learned about, say, consultations in primary care is that so often the GP has an idea of how the consultation will go. And young people say, I don't feel listened to. I don't feel listened to. And they say that about their parents, of course, too. So I think listening is so important. And I suppose I'd sum up by saying, young people need adults. They really do. However much they're pushing you away, they really need adults. And we know that the more engaged and supportive adults are, the better the outcome. So I think that's the biggest message for me. I say parents really matter, but also, when you think back to your own adolescence, we all know that there was a teacher or a neighbour or something who really, made a difference because they were on your side. They were listening. And so I think that's the biggest message for me. Do remember that young people really need adults in all sorts of settings, and you could be a really important person in their lives if you can be there for them.
Thank you, John. You've been a great inspiration to me and so many other people. It's wonderful just to hear your story and hear the messages and the lessons. And it's great to hear you're still carrying on with the mission.
Definitely am.
So thanks once again for
thank
today.
You for listening to me. It was very kind of you.